Welcome to Reimbursement Rx video. Today we're going to discuss one of the most frustrating parts of being a physician. Whether you are in private practice or whether you are an employed physician. This most common frustration leads to burnout, leads to decreased effectiveness, and decreased use of your time. And we're talking, of course, about third-party interference. Now, this could be any party that directly interferes with you seeing the patient and effectively managing the patient. We, of course, are talking about Medicare, insurance companies, and pharmacies. Most physicians say that insurance companies a lot of times do not allow them to do what they feel is right for the patient. Medicare sometimes places or puts restraints of what you can and cannot order or where you can and cannot send to patient. And of course, pharmacies, as guided by insurance companies, may deny certain medication that you can prescribe. Well, we're not going to tell you that we're going to change the system overnight. There are a few things that you can do to make your life better, more efficient, and in turn, it will lead to a better satisfaction. And that is, you need to set up ground rules. You have to decide for your practice, no matter which setting you're practicing at, how you're going to handle those requests and how you're going to handle anything that comes between you and your patient. And basically, it means that you need to cut out the middleman. So when you order a necessary test, procedure, or lab workup, and you have denial from insurance companies, a lot of times there's a lot of back and forth. A lot of faxes coming in, asking you to fill out certain questionnaire. You have your medical assistant or nurse do that. You go back and forth, wasting time, and thereby sometimes delaying treatment. So what can you do? Go straight to the top. At the moment of denial, skip the unnecessary paperwork and demand that you speak with a reviewing physician. Yes, every insurance company has a doctor assigned for a particular task. If it's a test that you're ordering is being denied, there's a physician in charge of that. If there's an imaging study you're ordering and it's being denied, there's another doctor who's attached to that. Now, they're not seeing your patients, you are. And if you truly believe what you're ordering is important, go to the top. Talk to the physician. It takes 2 minutes. They always will take your call. And most of the time, vast majority of the time, they're going to approve what you're asking for because you, as a practicing clinician, will tell them why you believe this is the right thing for your patient, and they will agree with you. If they don't agree with you, there's not much more you can do. Move on. But skip the unnecessary steps of going back and forth with faxes, telephone calls, and emails. That takes enormous amount of time. As far as medications, sometimes insurance companies will demand that you prescribe a generic drug for one reason or the other. And sometimes it works, sometimes it doesn't. When you truly believe that a brand name prescription is vital for your patient's well-being and sometimes even survival, there are a few magic words that you can write and you can send it to your insurance company, and almost always it's going to be approved. And that is, of course, if you write that the patient will die without the medication. Now, you need to truly believe that, and you need to truly feel that this is an important medication for your patient. And if this is the case, the medicine will be approved. It doesn't seem like much, but those 2 easy steps, talking to the physician in charge and standing up for your patient or prescribing the correct medication, will save you a lot of time, will save you a lot of money, and improve your patient satisfaction. So if you or someone else you know find yourself in these situations, please share this video and please comment below and tell us what you think. Thank you for watching. Reimbursement Rx is very proud to announce our first webinar series. We are going to have 2 live webinars this March. During those live webinars, we'll be able to take questions live, and we're going to detail how we can help you navigate the very complicated world of medical administrative reimbursement and explain the financial flow chain that is very difficult for new doctors to understand and seasoned doctors to keep up with. We'll be able to tell you how we can help you not necessarily find a better job, but be happier in your workplace because you will be able to understand where the money is coming from, what you're working so hard for, and how to get paid for this adequately to enjoy your professional medical life and feel like you're being well taken care of. Yes, there's a way to do that in various settings, be that private practice or an employment opportunity. You just need to know how to take advantage of those things that are out there for you.